So head injury or head trauma is the pathological result of any mechanical force to the scalp, meninges, or brain. So head trauma resulting in injury to the skull, or to the brain or blood vessels. So the underlying cause or pathology may be the primary injuries or secondary injuries. Primary injury like acceleration or deceleration injury resulting in shearing or injury or destruction of the brain tissue or skull fracture or any kind of hemorrhage like brain herniations or hemorrhage or hematoma formation. It might be epidural, subdural, or intracranial hemorrhage, but all can cause the primary injuries. And secondary injuries, I said the reactive process after the initial injury. So reactive process after the initial injury may be hypoxia or increased intracranial pressure or cerebral edema and further damage of the brain tissue. So this open head injury occurs when there is a fracture of skull or a penetration of the skull by the object. So underlying risk factor may be fall or any sports-related injury, motor vehicle accident, or any kind of abuse. Like in this picture, we can see the second baby syndrome. This is the one kind of risk factor or abuse, right? So this said, closed head injury is the result of blunt trauma. It is more serious because of chance of increased intracranial pressure, right, in a closed vault. And this type of injury can also be caused by second baby syndrome. This is the abuse. And NCLEX would like to ask question, what are the signs and symptoms of increased intracranial pressure? Also manifest depends on type of injury and subsequent amount of increased intracranial pressure. So if patient have a very mild head injury, they present with headache or they present with confusion, dizziness, blur of vision, or lethargy. If patient present with the severe head injury, the most common sign symptom increase the intracranial pressure. So how we understand my patient cranial pressure get up, right? So if intracranial pressure go up, we can see the systolic blood pressure go up, but pulse rate go down, respiratory rate go down. How you distinguish from shock? Compare contrast, increase intracranial pressure and shock. Shock, blood pressure go down, hypotension. But increase intracranial pressure, systolic blood pressure go up. Pulse rate go down, respiratory rate go down, whereas the shock, pulse and respiratory rate get up. Both are important in NCLEX board exam. Also, patient present with hemorrhage, weakness, unsteady gait, and seizure. In this picture, we can going to talk a little bit more about second baby syndrome. So it is a serious brain injury caused by the second of the infant. Okay, and it can cause serious brain damage, and it may be danger or life-threatening. And It is treatable by a medical profession, but I said diagnosis is very important. Then we will talk about the treatment. So in this picture, we can see this portion of the head is pre-injured contour of the skull, and then immediate post-injury contour of the skull in this side. It is subdural vessel injury as well. So what next? Increased intracranial pressure that we already little bit talk. The child level of consciousness provides the earliest indication of improvement or deteriorate the neurological conditions. Early sign maybe change the vital sign or slightly change level of consciousness. In case of infant, irritabilities, high pitch cry, bulging fontanelle, increase the head circumference, dilated skull vein, or sitting sunrise syndrome. In case of child, headache, nausea, vomiting, visual disturbance, and also chance to develop the seizure. So the symptom of increased intracranial pressure are very depending on person age. Infant with increased intracranial pressure may have a different symptoms to older children or adult with the condition. The symptom basically increase of intracranial pressure can include what I already explained here: headache, sleepiness, blood of vision. If you check the blood pressure, it should be go up, pulse rate go down, respiratory rate go down. And in case of late sign, decrease the level of consciousness, bradycardia, and decrease the motor and sensory responses, alter the pupil size and reactivities, and also we can see a special type of posture. It is called decorticate and decelebrate. Decorticate posture, it is flexion. It is adduction of the arms at the shoulder. Arms are flexed on the chest with the wrist flexed, and hand is fisted, and the lower extremity extended, abducted. So in this picture, we can see this is decorticate. So two arms are moved inward, the midline, the body, look like cord, C-O-R-D. The alphabet look like C, decorticate, D-E-C-O-R-C. It look like this. And this type of problem, most common in the cervical or spinal tract injury or cerebral hemisphere. And decelebrate, the second picture, we can see both arms are away from the midline, right? And this is most common problem within midbrain or pons. So let me go back. Decelebrate, it is extension posture, rigid extension and pronations of the arms and legs. Is a sign of dysfunction of the level of midbrain. I told pons, midbrain or pons. And decorticate, seen severe dysfunction of the cerebral cortex or cerebral hemisphere, spinal cord problem, cervical problem. Also, patient has a cramped stroke, respiration, and coma. So what are the nursing intervention? Before to go nursing intervention, if you ask me how we diagnose it, definitely CAT scan, MRI, or neurological assessment. And the treatment basically conclusions or temporary alterations in the brain function, and is usually the self-resolving in 1 to 3 weeks, and rest and gradually return to activity. And very severe head injury needed treatment, basically medication or some procedure. Medication, we always tell patient to take mannitol or hypertonic sodium chloride. Phenobarbital is very helpful, anticonvulsant, opioid analgesic. And some procedure like mechanical ventilation important, intracranial pressure monitoring important, craniotomy is important if any kind of brain herniations or hemorrhage or hematoma formation. Craniotomy means remove the non-viable brain tissues. So what are the nursing intervention? Particularly in immobile the neck and spine after head injury, if a cervical or other spinal injury is suspected. When a spinal cord injury is rolled out, elevated the head of the bed 15 to 30 degrees. If not contraindicated and as prescribed to facilitate the venous return. Monitor the airway and administer oxygen as prescribed, and also need to check injuries. Position of the child so that the head is maintained midline to avoid the jugular vein compressions, which can increase intracranial pressure. Monitor vital sign and neurological function as well. And also notify the primary healthcare provider if the sign of increase the intracranial pressure occur, and keep the stimuli to a minimum. Attempt to minimize the crying in the infant. Sedating medications are withheld during the acute phase of injury so that changes in level of consciousness can be assessed. Initial seizure precursor or monitor for decreased responsiveness to pain. Maintain nothing by mouth status or provide clear liquid is prescribed. So emergency care is important, like stabilize the cervical spine. We said immobilize the neck. Maintain patient airway, right? Monitor the airway, admit oxygen. And also monitor vital sign, level of consciousness, EKG. So decrease intracranial pressure means reduce hyperapnea, or avoid suctioning or head of the bed at least 15 to 13 degrees, and head supposed to be in the midline posture.